and here we are today. This is session number 3 with Dr. Bert Hodus for Ask Dr. Bert.
Ask Dr. Bert. Now, we haven't figured out if we're going to spin this off into a series yet.
Yeah, there we go.
But you guys on WTCO will be the first to know.
Would this be a weekly call-in show, maybe?
I don't know. I was wondering about syndication.
Can you work on getting us a bus with like hair and makeup? Okay, we've got promises. It's been videotaped. Dr. Bert's going to work on our bus.
And we did. We called and said we wanted, makeup and wardrobe and the hair people here by 2:30, and they never showed again.
Again, disappointment.
Yeah.
Replent.
So what you see is what you see.
And we are in kind of, I'm going to say, the very bowels of winter.
Oh, gosh.
Although it's 40 degrees. It's like warm and sunny. But unfortunately, we are all living on ice sheets right now.
Yeah, we are. So, and I need to mention here that Bert is now retired, correct?
I am.
Yep.
His fee is much less now. That's how we can afford to do these shows.
So how are you spending your time now, your free time?
I'm strapping on the yak tracks and crossing that ice sheet.
Oh,
Yeah. And spending time with my dogs
well, that's
and
good.
barn animals, and I play the violin, so I do that most days. And
Awesome.
I'm getting a chance. I like to read, and I've always read, but now I can finish books fast, where
Yeah,
it would take me a month sometimes, and that's not really a way to read a book. So I'm enjoying that and spending time with my wife, and we're not doing a lot of traveling, but we're having a lot of visitors. So
Oh, that's nice.
Yeah, it's
Isn't it
nice.
fun to have company over?
yes.
And it's nice
Usually.
to know that he's not just laying at home on the couch playing video games and
Oh, yeah.
I would if I knew how.
well, let's get down to the meat of this session here today. Because we wanted to ask you about some diseases that we don't
good.
see much of nowadays, particularly around here. But in the history, these were diseases that were deadly and just wiped out people like
Left and right.
Yeah.
Like Tic Tacs.
Yep. And the one I thought we'd start out with is cholera. Can you tell us anything about what cholera is and how it spreads?
Sure, that's a good one because
It's a
we
I know. It's a good one. Oh,
No.
you mean for discussion?
for discussion.
Okay.
And we should all be real receptive because we're just kind of passing through an epidemic.
Yes.
Yes.
And cholera has been just a nasty recurring epidemic. It's a bacteria. It's not a virus, but it's chased civilization for many centuries. And
Chased civilization. Now expound. Where does cholera come from?
cholera comes from water and maybe unwashed vegetables.
Okay.
Or it's actually it comes most frequently when there's a breakdown in proper water management and
Okay.
water treatment. That's why we don't see very much of it here or in Europe and actually most of the world, but there are hot spots all around the world. It continues to be a problem. It's not gone away. There is treatment for it, and we know how to effectively treat it, but sometimes some of these disrupted circumstances don't prevent healthcare workers from being on the spot. But it's always out there, and there are possibilities. There really are not cases in this country, but in the event of, we had really severe flooding in California a few weeks ago,
yeah.
and fortunately they have the wherewithal and the expertise to quickly recover from that. But there have been other places in the world, including Pakistan this last year, where they had such extensive flooding that they had breakouts of cholera because they just couldn't deal with all of the flooding.
They couldn't get clean water, and
Right.
people were not only probably walking in dirty water, right? But they were also probably drinking dirty water.
It was overwhelming. The normal they have water management systems, but it was overwhelmed.
Right,
A quarter of
right.
the country was in water, so it was not possible. And there are places also that have cholera kind of often. And
So what are the symptoms? How do you know if you're coming down with cholera?
it's really not difficult to know because first of all, your health department or health providers are aware of breakouts. It tends to be an epidemic kind of phenomenon. It's not just random individual cases. So usually the healthcare workers have a mind of it, and they act on a hunch. And even before the diagnosis is made, they understand this is going around. And then the symptoms are diarrhea.
Projectile?
No,
Like,
not really.
Like we're
I don't
having
know.
a colonoscopy kind of a deal, or well, there's I'm sorry, but there's varying degrees of
Yes, Mary.
how your body reacts to whether you get a food poisoning.
Right. It's
or-
not vomiting. It's more diarrhea, and the
Okay.
diarrhea is dramatic. And there's a whole range. It can be mild. It can be very severe, and certainly untreated, I don't know, half of the people would die.
Is
of
that
it.
from dehydration?
Totally.
Okay.
Because that throws off, you're losing all of your potassium, you're losing other electrolytes, and the body goes into shock. And then you have, if you can't get to an IV, basically,
Yeah.
you die. Your system's shut down,
Right.
or your heart stops functioning because the potassium is so low, and that's what people die of, is shock.
And how
Wow.
fast does it, is it a disease that you linger, or is it fast, or?
Or all the above?
I think it's probably all of the above. It may be a few weeks, but it comes on very quickly,
Wow.
like within a day, within hours probably, and then it's not something that you are exposed to, and then a couple of weeks later you come down with symptoms. It's quite quick.
Wow.
And then, can you die from it real quickly then too, or
Sure,
not?
sure.
If you dehydrate,
Yeah.
Right.
everything shrivels up, and when stuff shrivels up, that's not good. They shut down, they stop
Right.
working. Probably kidney function is changed, liver function. Well, like you said, the potassium with the heart business.
Right. Your muscles require a very tightly controlled electrolyte environment, and the heart is particularly sensitive to that. So if you bottom out on your potassium, your heart stops working.
And I would think that if the main problem is diarrhea, that you'd have to be really careful that you weren't reinfecting a bunch of other people then.
Right, and so that can happen, and so there are dangers to the caregivers, the
Sure.
family members, and so forth, and it's like any infectious disease. It hits people that might be weakened or older harder,
Yeah,
and
vulnerable.
but it also
immune deficient.
right.
That's the word
So-
we've heard of a lot the last 2 years.
So that makes you more vulnerable, but it certainly can also severely affect healthy adults too.
Healthy
Yeah.
normal people.
Yeah.
And you treat it with an IV, I guess, huh?
Almost always. There are antibiotics, but I don't think they're used very much. It's mostly hydration, and
Yeah.
sometimes, well, if you're really dehydrated, somebody pushing water at you is repugnant.
Right.
It's like I can't possibly, and so it's hard sometimes to orally hydrate. And in that case, no, you put a electrolyte IV solution and run it fast, because the amount of diarrhea and the loss of fluid is really dramatic. And
So it's a race against fluid intake and fluid outgo
right.
to keep
Yeah.
everything at least with enough moisture. Then does it eventually work its way out of your system? Does it just get to like critical mass and then begin to die off.
Right, and you think about an infection just sort of swarming your whole body, but it's not really like that. This is a gastroenteric pathogen, meaning it goes into the stomach. The stomach actually is high acidity and it sort of blocks it, but some sort of trickle through, and then they land in the small intestine, and it's a toxin of that is called the Vibrio.
From the bacteria.
From the bacteria.
So you actually get sick from waste product from the bacteria, correct?
Right. Well, it sort of weaponizes that toxin. Yeah.
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 We get sick from bacteria do.
It's ugly all around.
It is. There's
they-
just no happiness.
How did they treat it before they had IVs?
I think they realized that, well, dehydration's been understood, and I think they probably.
IVs.
These people died by the thousands.
When did IVs come on the scene?
I don't know. I can sort of picture it. I don't know, mid 1900s, something like that.
Okay.
So I don't know, and I don't remember ever seeing in the history of this county that they had cholera.
In Trempealeau County?
Yeah.
It-
I don't
It
think
has
so.
actually been, say, 90 years since we just don't have cholera in this country.
Did you ever see a case of cholera?
I have not.
Okay, so we don't have to worry about it too much right now.
No.
Wash your hands.
But
Yeah.
you go places. I mean,
Yeah.
they do as close as like Haiti.
Oh, yeah, I'm sure
You know,
they've
so
been
you have
traveling.
and people travel to Southeast Asia.
Yeah.
They have that there, and they have. So you just have to be you should be cautious for a whole lot of reasons
Yeah.
about drinking the water from the tap and
Yeah.
and buying food from vendors. I mean, I'm not trying to run down vendors' businesses, but you have to be very aware of how food is prepared. For
Sure.
instance, if it's washed, because cholera is not the only thing. There's a lot of other things.
Yeah.
There's a lot of little things out there. I always used to say, when the Bible says the meek shall inherit the earth, that may not just be shy, quiet people. That might be those tiny little things that we never even know that they're there until...
The bugs?
Yeah.
Oh, yeah.
Bacteria. I mean, you name it. Bacteria, fungus, viruses. They're pretty little and
Yeah.
meek
Yeah.
until they overtake
They
you
get
and
you.
Yeah.
land you in the hospital with an IV in your arm.
So now that we've kind of got a handle on cholera, there's two other diseases, and they used to be around a lot in the old days, and in this county as well. Now there was typhoid, and then I've always heard of typhus. What's the difference?
Those two have been sometimes mixed and conflated, but the reason is that some of the symptoms are the same.
Okay.
But the cause, so typhoid is caused by salmonella, and typhus is caused by rickettsia. And so those are two totally different bacteria. And it wasn't, that used to ravage the population too, historically,
Yeah.
going back, both of them. And then it was then sort of like, with a microscope is a great invention, and you can just see, oh, this is this one, this is this one. And they're spread differently.
But typhoid, wasn't that something that people could carry and they didn't know it and they were infecting other people?
Oh, yeah. Yeah, that's the thing. And we have had typhoid fever in this country.
Yeah.
It's not prevalent because the same kind of thing having to do with water management and cleansing helps to prevent that one too. But you can be a typhoid carrier. You've heard of Typhoid Mary?
Right.
Yes,
Okay,
that's
okay.
what,
All
that's what's coming to my
Mary.
mind. I'm
So
thinking, okay.
I can tell you about that one. I mean,
Okay.
there was not like a great big offender because I think maybe a few dozen people died actually
Yeah.
serious, but
Yeah.
it's a lot of water under that bridge. But this was like maybe 100 years ago, and she was a cook. And it probably is famous because she was a cook in the home of affluent New York families.
Socialites.
Yeah,
huh?
and she didn't know it. She was asymptomatic and she
Right.
was a carrier,
Yeah.
and so it wasn't her fault, but it probably shed a lot of light on the model of how that happens. Is that
Yeah.
people can be silent carriers, but
And
Well, then how is it spread? If you're a silent carrier, is it like on your skin or
on your
Well,
hands.
on your hands?
yeah, and if she
okay.
was a cook.
Yeah,
Yeah.
she's
Yeah.
chopping and
She was
cutting
handling a
and-
lot of celery.
Yeah.
Oh, boy.
Yeah.
And so, what are the symptoms of typhoid?
Fever
Oh,
is a
okay.
bit, and then there's a whole slew of things, abdominal pain because it sort of affects your stomach and your gallbladder and your liver.
Oh.
It can and the high fevers can lead to confusion and death. I mean, this is the thing about typhoid fever is that it's treatable, not with just hydration, because diarrhea is not a big problem with it.
okay.
I think you can get that with it, but it's not the major symptom. But that one is treated with an antibiotic. And before the 50s, there were no, and even or more recent than that, because the antibiotics that we would use for these are more recent invention than 1950s. And now I think that people don't usually die of it, but if you're not recognized and not treated with an antibiotic, that you could get better, but still the death rate is really quite high.
Well, and I suppose if you spike a temp, I mean, our body is designed to operate at that sort of cool 98.6, right? And the more you crank up that dial on the heater, on the furnace, it does damage to your
Oh,
body,
sure,
including you can like cook your brain, can't you?
Sure.
If you run a high enough
It
fever.
was somebody. Oh, and it's for an adult. It's very unusual to get like 103,
Yeah,
104.
right.
That's what you would see with that. And so yeah, you try that temperature out, and you're not thinking very straight.
Right,
And
right.
but I don't know about permanent brain damage, but I think meningitis is something that happens with that too.
Okay, there's
So-
another one,
So
meningitis.
that's well, a lot of things can cause meningitis, but in the case of typhoid fever, meningitis is often lethal. That's a bad thing to have. And then it also can do permanent damage.
Wow.
So
No, I suppose I wonder if those were the days where they did the ice bath thing.
yes,
Probably
Where-
to get the fever down.
They would put people in tubs and barrels and what have you, and they would fill them up full of ice.
but that was no picnic.
Oh, no. I mean, if you were outside doing anything, like not a week and a half ago, 10 days ago, it was brutal. I mean, my fingers were numb in minutes.
Right. They didn't know what else to do, and
Yeah.
people would die, by the thousands. It would be, and that is still around, and it does occasionally pop up in this country, and not very much, but
Rare.
it does rare, yes, and and then in pockets around the world too.
Well, so what is typhus then? How is that different?
Typhus so typhoid only exists in humans, only
Okay.
exists in people. It doesn't exist in dogs, cats, rats,
Yeah.
and other
Yeah.
squirrels,
Yeah.
flying squirrels. No,
It's not
no,
in the
none of
animal-
those things.
Not in the other animal kingdom.
No, but rickettsia is something that does. It's carried by other animals like dog or squirrels, or, other things, rabbits probably, and it's carried. I'm sure of that actually, the rabbits, but it's carried in fleas and lice. So in that case, and then you get then humans. So it's sort of like is papoosed along with the lice and the
Yeah.
fleas. And then if you're exposed, say if you're poor, and you're in jail, or you had an earthquake, and now you're living in a gym with 3,000 other people, and you can imagine how body lice and so forth could just
Move.
make the rounds,
Yeah.
and then you come down with this, and that's not something that happens just like that. It's not like cholera, but over a week or two, then the symptoms come on. And symptoms are kind of similar to typhoid fever, but
But the
treatment is different. And actually, like a lot of bug-borne, actual like insect bug, like ticks and lice,
Yeah.
and medicine as common as doxycycline would be the treatment of choice for that. It's interesting to talk about things that are rare, maybe used to happen with
Yeah.
a lot of frequency, but they still are around. And some of us feel kind of casual about these diseases because we don't get them here.
Yeah.
But as we saw with COVID, again, I don't want to keep coming back to that, something that happens in this little county and over here, the world is really globally connected.
Right.
So if the better you understand like emerging resistance of typhoid fever, that the salmonella, because there is some resistance, the sooner you get on that in Haiti, the
Right.
better it is for us.
Yeah.
Well,
Even-
you stop
even-
the spread.
Right.
Right? You
Right.
you keep it from translocating from one location to the other. And like you said, with the globalization of the planet, somebody can hit 3-4 countries in a day
Oh yeah.
as they're moving.
Right,
Yeah,
and in
right.
something like typhus we were just talking about is something that I might be exposed to, maybe if I'm doing something, field work or something
Right.
in Haiti. And then I feel fine, and I get on the plane and come back for Christmas break, and I'm just with my family, and I have typhus. But it doesn't really emerge for 10 days or a couple of weeks.
And by then you're in New York at a
All over the
theater
place.
fest.
Oh, I'm just
And
loving
then
it
you
up.
and then you
Everybody.
fly to Los Angeles to do something
Oh,
on the
yes.
beach.
Everybody
Right.
else is getting
Right.
infected. Ooh,
So
that's scary.
Infectious diseases
Yeah.
are interesting, and we'll never really be rid of them. It's like you say, the meek,
Yeah.
the bugs, those little
Yeah.
bugs.
Now, Mary also had a question about something that we used to see written about people had the grip or the gripe.
Grippe.
Yeah.
It was in the Whitehall Times.
Yeah, it was
that
common.
the Gabe Anderson and then I think there was an Erickson family listed that were right down here, just down the road from our outdoor studio location on Square Bluff, that they had come down ill with the grip or gripe.
I think it would be Grippa.
Grippa.
So
okay.
Grippa is like
Oh.
they used to talk about this in German history, German literature, and the Grippa is flu. And there's a lot of German people here in
Yeah,
Trempealeau County,
yeah.
so you could see how that, Grandma would have brought that to the family, and it's sort of like it circulates, not the disease, but the word.
Right.
Yeah.
And actually, it's a really good word. I mean, it's sort of like what flu does. It's sort of like, oh, I got the cramps. You know.
I'm going to quick show you a couple of pictures I found here
All right.
on the internet, and you might be able to talk about them. This picture, I think this was during World War I. And here's this doctor. I don't know. He doesn't look like he's operating in very fantastic circumstances.
Wow. Look at that. He's on sawhorse.
That's a good dude. Adaptation. Like, okay, so this guy he was taken right from the field.
Apparently.
That was like a.
Ooh, that's okay. We just have some. We've got minutes yet.
We've
Go
got
ahead.
a little bit
Okay,
of time.
yeah, so he came on a stretcher right
Yeah.
off the field onto the sawhorses at the ready. They look like they're at a good level, just like an OR level.
Yeah.
And he has the doctor has an assistant. They aren't masked, but I don't know if they're in the middle of a surgery. He may just be sort of assessing. Looks like he's got a junk
He's got a
bucket.
there full.
Yeah,
Oh,
it's-
the last guy's stuff. The
yeah, maybe last guy's. And I hate
surgical-
to say it, but there's a lot of blood on the floor. But
So this
he
was a
does
war
have an anatomy a map on the back.
Yeah.
And I don't know what this is.
I think
Looks like
that was
some-
different kinds of shrapnel and bullets and things.
Oh, okay.
wow.
Well, that's good. You want to show off
'Cause
your
that
stuff.
was what happened. A lot of these guys took shrapnel,
Right.
and that
Yeah.
was terrible. But he's not in He's really in makeshift quarters there, I would say.
He is. He does have pretty good light behind him.
He's got pretty good.
Well, that's
He's using
important,
sunlight.
Mary.
What would happen if,
Well,
a
that's
big,
true.
a big dark cloud?
Well, maybe there's a big chandelier out of the
Yeah.
picture. I'm just saying it's
You would
good.
want to see what you're doing. That's got to be important.
Right.
And then there's another one here because they said, like, I think this is World War I too. When they did a triage. When they brought the wounded in, they would first come to this first station, like maybe that's where that guy was. And then if he knew it was something that he couldn't handle, he would send it on to an evacuation hospital. And that might be what this is, where they dealt with more serious cases.
Versus kind of more the Band-Aid station where
Right,
you got
right.
shot in the arm and we just got
Yeah,
to get the
something
bullet
that
out.
they could
and-
fix pretty well, but if
something
it
simple.
was really serious, then they moved him on to this other.
And yeah, in this case, it's a whole team, and
Yeah.
the nurses look very intense and competent, and it looks like the equipment is like this is either some sort of high-end tool or a samovar or something. I don't know. Anyway, you want to, and it's like now they are sharing a room. I see these two patients. Is this a patient?
Yeah,
Yeah,
that's a
it looks like,
patient.
So-
looks like he's got something up in
Traction.
Yeah. So
Looks like maybe a
he's-
leg. Wow.
Can't see that.
But they look tough. Neither one of them look like they're ready to go out and do a polka or a waltz
they
or
look
a
like they're
schottisch.
hurting, don't they?
No, they're probably glad to be in a bed right now.
I just think it's amazing that anybody survived back then when they got hurt like this.
Well, yeah. I mean, you think of it at the timestamp, they didn't have antibiotics.
no, they didn't.
So, gangrene had to be rampant.
And they didn't.
Right?
They
Yeah.
were just seemed like they were just catching on to the idea of germ theory. That was something kind of new, and a lot of people didn't
Right.
realize that you really should be washing and sterilizing things.
All right, that
Well,
was
look at their own
controversial.
light.
Gloves. It was like a brilliant idea that somebody had is that we should be wearing gloves and wash our hands.
Right.
And I mean, but it wasn't that people weren't being consciously ignorant,
Yeah.
or stubbornly ignorant.
Yeah.
It's just that germ theory wasn't really understood,
Yeah,
and
that's-
how and even now, I mean,
We're learning every
yeah.
single day.
Right.
And I think this is an awful thing to say, but these wars were big learning opportunities for the medical.
They continue to be a lot of
they
the
learned a
orthopedic
lot of
things,
stuff,
and even in
right.
Iraq, a lot of this, it just really accelerates the
Learning process.
the learning and the
Yeah.
inventing, and some money is funneled in that direction, and it has a spin-off effect on treatment of civilians and
Yeah,
into
well,
the future.
my mother was a nurse in World War II, and she talked about two things that really helped people recover. One was they started using sulfa drugs.
Yeah.
And
Antibiotics.
that really made a difference. And the other thing, she said, because there were so many casualties coming in, that they couldn't let people just lay in bed. They got them up and they got them moving because they needed
The bed.
they needed the
They
bed.
needed the space.
And they found out that actually a lot of people got better when they had to get up and move around and not just lay there. I think we've got to get going here too, because I think we just about used up our time. But thank you, Dr. Bert, for coming up. And if anybody has any questions about any other diseases that maybe we don't get anymore, well, you can drop us a line there at the TV station. I always put the phone number on at the credit.